What I've learned from here is if I have a partner, I should have one partner, be faithful to that partner, and let that partner also be faithful to me, so that we don't get infected.
Yeah, it was nice because how this program came, we decided I've talked to my wife, then later he also agreed with me, then we go together.
I have combined with VHT knowledge and the Obanya program. Now I can give a very good advice to them. Now they are listening. Now I have been introducing one topic, but now I have so many things which I can tell them.
We had just little knowledge, we could talk to them, but since we were trained now, we have our special room, we invite mothers with their children in, then we talk to them.
The second phase of the Health Communication Partnership Project began in Uganda in 2007, with a mandate to create an environment that supports individuals, families, and communities to adopt practices that improve health.
Not only in the landing sites,
HCP has worked in close partnership with the government of Uganda and non-governmental partners to strategically communicate about HIV prevention, care and treatment, young people's sexual and reproductive health, family planning, male circumcision, malaria control, and tuberculosis.
There are kind of three things that we're focusing on in almost everything we do. One is trying to actually motivate people and educate people about what they're supposed to do so that they'll change their behaviors. But then we also try to change the social environment in which they live so that it's more conducive, or it allows them to actually adopt the behaviors that then they want to adopt. And then the third thing is this whole thing about trying to strengthen the capacity at all levels, trying to help communities, individuals, organizations, the government to be able to better communicate about health.
By mixing entertainment with health education and by using innovative and creative approaches from national mass media campaigns right down to community-based and interpersonal activities, HCP's goal was to motivate and enable people to act positively for their own health. HCP followed the systematic and results-driven steps outlined in the P process: analysis, strategic design, development and testing, implementation and monitoring, and evaluation and replanning. Participation and capacity strengthening supports the process.
Having someone that thinks through how the public can be informed about a service and standardize that and test that out and say, okay, this is the most appropriate way to say this is extremely helpful.
Communication strategies were developed based on a thorough analysis of research. The materials were pre-tested with intended audiences, and impact was assessed through population surveys.
They came as partners to help us improve health communication activities. They have been instrumental, they have been helpful in conducting BCC research. More often as government, we don't have money for that research, but HCP has always been there.
Committed to capacity strengthening, HCP provided training, mentoring, and hands-on experience in health communication at multiple levels.
When HCP came on board, the processes they went through, the way we watched the experts of communication go through the processes of developing IC materials, and we also learned that communication is not about standing up and saying something. Even how we developed the messages was a long process, and we understood as a minister that we must invest a lot in communication because this is how we saw, them doing. So even capacity was built among us in the ministry and with our partners, that we work with.
In addition to working with communication staff at partner organizations, HCP also provided technical assistance to strengthen institutional capacity in health communication. HCP established an internship program for new graduates called Generating Opportunities for Leadership in Development, or GOLD. Approximately 200 young professionals completed the one-year program, and the vast majority are now employed.
I did not know how to climb a tree, and God taught me, one, to realize there's a tree in our lives, but two, taught me how to climb that tree.
The Gold program was so successful that it has been handed over to the Private Sector Foundation Uganda, which will continue to support and expand the program beyond the end of HCP. In order to reach as many people as possible in the most effective way possible, HCP adopted a strategic approach based on the Pathways to Community Health model. Creating an enabling social and political environment for positive health practices. Strengthening quality of health services. Mobilizing and sensitizing communities. And stimulating dialogue and individual behavior change. HCP worked to create an enabling social and political environment for positive health practices by disseminating policies, influencing underlying social issues such as gender norms and HIV stigma, and working with the media. In addition to multimedia campaigns, HCP created visuals to explain how the Domestic Violence Act works and has provided health centers with support to explain how people should be treating each other. Considering the important role that media plays in shaping public attitudes and norms, in partnership with the Uganda Health Communication Alliance, HCP trained 400 media reporters to report more accurately about health issues.
I have learned to communicate with the community. When I'm talking about children, I know how vulnerable it is for a child to learn that he or she has got HIV and this child needs treatment. I have learned how to convince the community to take these children for medical checkup.
Before designing communication strategies, HCP worked closely with the Ministry of Health and implementing partners to identify gaps at service delivery level. Training curricula, job aids, and other innovative tools were created to support health workers to provide user-friendly, quality information and services. In the pediatric HIV program, 2 national curricula were developed to improve the diagnosis, care and treatment of children living with HIV, as well as improving the counseling of children and caregivers.
For some of the sites that we're able to monitor closely, we've seen really key increases in the numbers of children that are receiving treatment.
HCP has assisted the Ministry of Health to train health workers to better counsel family planning clients and people living with HIV and to provide care and treatment for HIV-positive children. It has developed job aids for health workers, police officers, the media, political leaders, and community volunteers. And working with partners, it has labeled HIV family planning and safe male circumcision services throughout the country.
The job aids help a lot in such health education sessions. The posters that are put on the walls also kind of like support the information that goes out through word of mouth.
To stimulate dialogue and action towards healthier lifestyles, HCP supported implementing partners by designing community mobilization approaches, tools, and materials.
Okay, I learned that much as I was using condom to these ladies, they were again having other guys whom they were going with live. So in a way, if I don't use my condom properly, I can get exposed since they were not protecting themselves with the other guys.
HCP worked with the Ministry of Health to design and produce a radio distance learning program for village health teams.
Okay, some of us we have been not knowing some things. Like we have been only knowing at least 3 types of family planning, but now we have known more according to the questions which we have found in the book, and we say this one also can work.
HCP has trained and equipped community resource persons to reach deep into the In order to stimulate dialogue and individual behavior change, HCP created new innovations. For instance, one of HCP's great successes was the establishment of the National Health Hotline, which provides counseling, information and referrals for health, HIV, alcohol abuse, and domestic violence services over the phone.
Anything you want to know about family planning, ask me.
It's the Nurse Mildred talk show interactions, and today's subject and topic is emergency contraception.
HCP also used the radio to tremendous effect, from call-in talk shows to radio diaries of people living with HIV to the Nurse Mildred Show and Rockpoint 256. Millions of Ugandans have been reached with health messages about family planning, SMC, alcohol, violence against women, and couple HIV counseling and testing.
People like the program. People ask many questions. Their questions are really answered, and people go to the clinics. Afterwards they go for services.
Like when she talked about types of family planning, I knew of about only 2 types of family planning. So then she let me know much about the types of family planning.
Perhaps the most successful radio show of its kind, Rockpoint 256, has reached vulnerable young people, affecting behavior change like no other edutainment initiative, past or present.
I would listen to something from the show, then in the world it is there. So when they came to that section of alcohol abusing, then it's when I started realizing that I had to change.
Over the last 5 years, HCP has challenged norms, stimulated discussion, and encouraged healthy behavior change through an array of innovative approaches. Thanks to a close working relationship with the Ministry of Health, Uganda AIDS Commission, and implementing partners, HCP has strengthened strategic communication capacity in Uganda considerably, ensuring these initiatives are sustained long into the future.
So they have been very, very, very important. They have contributed a lot in the area of health communication.
In testimony to the quality of HCP's work, it received 5 international awards for excellence in health and HIV communication, and many of its innovations are now being replicated in other countries.